Hey there everyone! Today I decided to make a video about the 10 most commonly asked questions I get from my patients about turmeric. Well, what is it? Its scientific name is curcuma longa. It's the rhizome part of the plant. It grows underground. It's almost like an underground stem. And it is part of the ginger family. It's been used by people of India and Southeast Asia, where it's native, for thousands of years as food and as medicine. It can be consumed fresh, usually in pickled form, or it can be juiced, but more commonly it's dried and used in its powdered form. In India, where it's native, its Sanskrit name is Haridrā. In Hindi, it's called Haldi, and in Marathi, it's called Halad. It has a lot of other names, but these are some of the common colloquial names. In Ayurvedic medicine, it's used topically for a variety of skin conditions, including infections. It's used to improve the skin's glow. So in traditional Indian weddings, the bride and groom will often make a paste of the turmeric and other ingredients like sandalwood and apply that to the skin. It's used for coloring food as a food coloring agent and as a flavoring agent. It's used for coughs and colds. It's used as an anti-parasitic medication. It relieves itching. It's useful in type 2 diabetes, urinary tract infections, gout, even hemorrhoids. It's used to regulate the immune system as a liver tonic and even as a hair remover. It's also used to dye fabrics. It was and is used in Hindu ceremonies. It's therefore very much a plant of the everyday culture. In fact, you can't have India without turmeric. But in Ayurvedic medicine, it's always preferred to take any medicine as a whole food, and turmeric is no exception. It's used in cooking, and you only need a very little bit for a big dish. So with all of its amazing traditional uses, it caught the eye of scientists who wanted to study it and who wanted to break it down and figure out why it was such a magical spice. Which brings me to my next question. What is curcumin? People often ask me, well, what's the difference between turmeric and curcumin? Aren't they the same thing? And the answer is no. Curcumin is just one chemical isolated or extracted from turmeric. And it's that compound that gives turmeric its characteristic yellow color. It belongs to a larger family of chemicals called curcuminoids. So since it was discovered, it's been glorified as a miracle compound. We know that, to use a cliche, the whole is greater than the sum of its parts. And we know that turmeric, therefore, is greater than the sum of its parts. We don't know all that turmeric contains. We haven't discovered all of those compounds. Curcumin is only one small part of it. So therefore, we should consume the whole turmeric so we don't miss out on the other compounds. Just like the saying is, an apple a day keeps the doctor away. Who says a capsule of malic acid or a capsule of farnesene keeps the doctor away? No one says that, because that's just not how we identify apples. True, malic acid and farnesene are components of apples, right? But that's not how we consume the fruit. The consumption of turmeric was never as a supplement traditionally, it was always as a whole food. Next question. How is curcumin taken? How is it dosed? How is turmeric taken, and how is it dosed? You generally buy curcumin in a tablet or capsule form at the store. The strengths and dosages of these compounds, turmeric and curcumin, are very high. In fact, they're ridiculously high. For example, 500 milligrams of curcumin twice daily is considered a normal dose. 1,500 milligrams of turmeric 3 times a day is a common dose. And you can buy turmeric in giant pill bottles. This is really over the top. Sometimes I feel like the motto in the supplement industry should be go big or go home, because it seems like from their point of view, food can't be medicine. You have to make an extract of that food and then put it in a capsule and make it convenient and something you can swallow on the go. I even read a case where a turmeric emulsion was given intravenously to a lady and it killed her. So there is such a thing as too much of a good thing. Turmeric capsules is such a thing. Next question. What are curcumin's side effects? So we're talking about curcumin now, the chemical isolated from turmeric. It has its side effects. It may slow down your blood clotting. So if you must take curcumin, you should let your doctor know, because he or she may have you stop it a couple weeks before a scheduled surgery. So let your doctor know if you're taking curcumin. It may also interact with anticoagulant, antiplatelet medications. It can cause a whole bunch of problems. Curcumin, again, we're looking at it just in its isolated form, is considered an estrogen-like compound. So it can, in theory, in the megadoses that people take it, worsen certain hormone-sensitive cancers, such as breast, uterine, and ovarian cancer. In theory, it may even affect sperm count, curcumin. But if you look realistically at the population of India, where turmeric has been used for thousands of years, where 100% practically, 100% of the population ingest turmeric, which contains curcumin, then you have to think, well, why does the country overall, not talking about individual cases, but overall seem to not have a problem with fertility? Why? Because nobody is popping curcumin capsules over there. Not now, not ever. People are not ingesting curcumin, which will have side effects. They are having turmeric in its whole form. Which is my next question. So if curcumin is no good, people ask, then is it better to take a turmeric powder capsule? And again, the answer is no. Why? Because this is a reductionist approach again, much like taking curcumin. It's an oversimplification. For example, if I have a problem, say knee pain, and I read that turmeric has these magical anti-inflammatory properties, and I read these glowing reviews, and I take a supplement, it may work in the short term, but it's not going to fix the problem. The first thing logically to do would be for me to examine my life and look at other things such as my diet, my activity levels, my exercise, and fix those things first before I try to latch onto a supplement from an Ayurvedic standpoint, or even a Western medical standpoint. First of all, 1 gram of turmeric powder is about half a teaspoon. So if you're taking 1,500 milligrams 3 times a day, you're taking 2 to 2¼ teaspoons of raw turmeric powder a day, unprocessed, uncooked. And that's a little less than how much I put in an entire pot of khichdi that can feed 4 to 5 adults with second servings, second helpings. So imagine taking that much raw powder, turmeric powder, every day for years. Something bad will happen. See, the powder is already a concentrated version of the rhizome. This reminds me of that old commercial with the old TV commercial where they would say, you need 10 bowls of your cereal, and then they'd show you this big stack of bowls, in order to get the same vitamins and minerals that you would get in 1 bowl of our cereal. So if turmeric powder is about 2% curcumin by weight, how many of those rhizomes are you consuming? It's a lot when you take a curcumin supplement. Even when turmeric is used as an Ayurvedic supplement in traditional medicine in India, most people don't ingest more than a teaspoon of turmeric powder a day on top of what they're having in their food. And if they do, it's generally in milk or an oily vehicle, and it's taken for a short period of time. It's a powerful medicine, so therefore you only need very little. Much like you wouldn't use, for example, a steamroller to fold a piece of origami paper, that seems silly, you don't need such a large dose of turmeric. Another disadvantage from an Ayurvedic point of view is a capsule will bypass the tongue completely. Ayurvedically speaking, turmeric needs to physically come in contact with the tongue and the saliva. You need to taste it, your body needs to recognize it as a food, and then this is where its digestion truly takes place. Digestion really takes place when it starts when we smell food or see food or even think about food. So that gets our juices flowing. So a capsule is completely bypassing the tongue and bypassing this first critical stage of digestion. Next question. How should turmeric be consumed if it's not taken in pill form? Then how do you eat it or how do you take it? So the properties of turmeric according to the Ayurvedic texts are as follows. Turmeric is bitter, it's pungent, it's drying, known as ruksha in Sanskrit. It's light, laghu, and hot, ushna. Those are the Sanskrit terms. So when you cook it, to balance these properties, we have to use substances with opposite qualities, and therefore turmeric is never used alone in Indian dishes. It's always combined with other spices such as cumin, fennel, coriander, etc. Also, you have to involve fat in the cooking process because the turmeric has both water-soluble and lipid or fat-soluble molecules that are useful. Let's say we make a tea with turmeric powder with water, that's not going to be as useful. So therefore we heat it in some sort of fat such as oil or ghee. Or we heat it in milk because milk is an oily substance. It's a fatty substance. And milk also has, according to Ayurveda, cooling properties that balance the heating properties of the turmeric. So you can see what a bad idea it would be to throw teaspoons upon teaspoons of turmeric powder in an ice cold smoothie. It's just not bioavailable that way. Next question. So why are large doses of turmeric or curcumin put in capsules? The reason is they have to use large doses of turmeric and curcumin because turmeric has poor bioavailability, and so does curcumin. So because of this, they feel like they have to put a lot in those capsules. And this is because, like I said earlier, they're not cooked, they're not used as food, they're not put in a fat, they're not put in, they're not heated. You need to heat turmeric as well. And that's why they need to put such big doses of curcumin or turmeric in these capsules. And to get around the problem of bioavailability, they add black pepper. Well, then you run into more problems. When you add black pepper to enhance bioavailability, now we have another problem in our hands, and that is that the black pepper, according to Ayurveda, is also considered pungent and spicy. And that just augments the pungent property, the hot property of the turmeric. And so you get reflux and you get heartburn and it can exacerbate ulcers. You know, your doctor is right to look at supplements, even curcumin, suspiciously. But we should all ditch this practice of ingesting molecules taken out of context that are extracted using our limited vision, our limited myopia. Let whole food, therefore, be your medicine. Now, you may experience some temporary benefit when taking the supplement. You might see amazing reviews online and be tempted to buy the supplement. But believe me, you will have side effects eventually. They will catch up to you. So the next time a miracle herb is touted on TV or on the radio or on the internet, think critically. If it sounds too good to be true, it probably is. And a lot of these herbs, if not taken properly, that is, if they're not taken or processed the way the original discoverers of the compound had been using them for thousands of years or for, many generations, then when we try to adapt them to our quick lifestyle, they can be dangerous. For more information about Ayurvedic medicine and about my practice, be sure to visit threeriversayurveda.com. Thank you.